Occupation for the record?
I'm Eli Bender. I'm a medical doctor. I'm board certified in immunology and cosmetic surgery.
Doctor, tell us how you came to know the plaintiff, Mrs. Hunt.
Well, Mrs. Hunt came to see me about a year ago complaining about severe pain in her joints. Now, she had done some reading and she felt that the cause of her pain could be directly related to her silicone breast implants.
Yes, sir, and what did you discover?
Well, a series of x-rays confirmed her suspicions. We found that her left breast silicone implant had a small tear in it, and it was leaking silicone into her system. You can see it here on the dark shadow on the bottom there.
Dr. Bender, where does that silicone go when it leaks out?
It's hard to say. It somehow dissipates into the system, but research has shown that it contributes to a wide variety of illnesses, the least of which is not pain in the joints. A series of tests allowed us to rule out everything except for the silicone.
And what did you do after reaching that conclusion?
I removed the implants.
And what did you discover after you removed the implants?
Well, the first thing we discovered was a crusting around the edge of the implant, and of course I found a small tear.
And the amount, Dr. Bender, were you able to determine how much had leaked out?
Yes, we estimate that the left silicone breast implant weighed approximately 96% the size of the right breast implant.
Dr. Bender, where did that silicone go?
I have no way of knowing.
Thank you, Dr. Bender. Your witness.
Dr. Bender, how many breast implant operations, sir, have you performed in your career?
Counselor, I no longer perform breast implants.
Doctor, that is not what I asked you. I asked you how many breast implant surgeries you performed in your career.
Approximately 7,000 over the last 15 years.
And of those women, doctor, how many returned to your office to have them removed?
Maybe 2%, 130 patients.
Well, did all these women have problems with their joints?
No, they were complaining about a variety of problems, from crusting around the edge of the implant to pain in the chest and, of course, in the joints.
So, by my calculations, doctor, there were some 6,800 plus women you implanted with these whom you never heard from. Would you conclude that these women were happy with their implants and apparently had no problems?
Well, I guess you could deduce that, but you have to understand that I concluded this based on the female patients I saw returning to my office. I felt I was no longer comfortable with the procedure, and therefore I stopped performing the operation.
Now, Dr. Bender, you did an extensive workup of Mrs. Hunt, didn't you?
Yes, we did a whole battery of tests to determine if there was any link between the pain in her elbow and the knee. I was able to rule out arthritis, tendon, and muscular problems. In my opinion, there is absolutely no way she could have suffered this severe type of pain unless silicone was leaked into her system.
So you're prepared to testify here in court today, Dr. Bender, under oath that to a reasonable degree of medical certainty, these leaking implants are causing the discomfort Mrs. Hunt claims to have?
Medical science is not absolute. But if you look at the record...
No, Dr. Bender. Medical science is never absolute. Thank you. I have nothing further.